Just wait for the message to come through. There we go. We're broadcasting now, Councillor Fairhurst.
Super, thank you. Right, good afternoon, everyone, and welcome to this decision day. I'll start off. I think you're coming next, Jan, with some grants.
Yes,
So
I'm following you. Yeah.
Yeah. Okay. So shall we just press ahead? Who's presenting? Graham, you're not. Simon, no.
I'll start off and then I'll hand over to Abby.
Oh, super. Thanks, Simon.
So I think the colleagues are very well aware of the Live Longer Better programme, which really is gathering momentum, and this is another aspect of that to work with our colleagues around the county. So Abby, hand over to you, I think.
Brilliant, thank you. So the purpose of being here today is to ask that the exec member approves to open a grant scheme for the district and borough councils and approves a total spend of up to £165,000 under the grant scheme set out in this report, and that you were to delegate authority to Simon Bryant, the Director of Public Health, to approve the individual grants that would go out to district and borough councils. So as Simon said, this is really to further develop the growing Live Longer Better programme, which is part of a national revolution to support older people to live their later life in good health. So we know that we live a long time, but many years of that at present is lived in poorer health. And this is all through the lever of moving more. So we've done loads of great work so far within social care, but we know if we wait until people come into social care and receive services, we've missed this whole huge opportunity for prevention. So we're really looking to support communities of practice, which is something that will be led and developed by the districts in partnership with community and voluntary sector to really develop and deliver local change to meet local population needs. So this grant will support that local delivery. We're currently working up some proposal paperwork to ensure that the districts can set out what they want to achieve and those local needs and ensure that they are part of the Live Longer Better umbrella and really driving forward the change that we want to see. So that's all from me. Over to you, Councillor Fairhurst.
That's wonderful, Abby. Can I ask, because I know we do the Better Balance and that for a much older population.
That's right.
What age would you like this programme to start at? When are you targeting it to get people involved before they need our Better Balance, if you like?
Simon, do you want me to answer? Or?
Well, I'll start off, Abby, and probably give a slight. I think what we need to do is start to get people active and thinking about this much earlier. And so this programme is, I guess, when you say it's an older age programme, it really is preparing for older age and those kind of things. Abby, you'd probably give a better accurate term on age.
Oh, great, thank you. So we're sort of targeting all of this at people in their 60s, 70s and beyond, because we know it's never too early nor never too late for people to make those positive changes to their lifestyle. So yeah, there are absolutely things like the Steady and Strong programme, which is supporting people to prevent falls. And this is really looking at some of that upstream prevention opportunities as well through more general strength and balance opportunities. So if you have a look on our newly launched website, you'll see lots of information there about the different ways that to support people to move more, whether that's just starting out and getting started, or if someone wants to keep improving.
That's brilliant. Are you getting a lot of buy-in from the districts?
So far, so good, yeah. We've got certainly some districts that we have presented the Live Longer Better programme to and are in conversation to launch a community of practice. We want to take a steady approach. There are only a handful of us within the Live Longer Better team. So in a way, it's a good thing that we're sort of having a slow and steady approach to the district involvement so that we can really give them our attention that they need to really drive forward the change.
Super, thank you. It'll be interesting to see if we can work around to getting them all involved.
Yes,
but,
absolutely.
I think that might take some time. Graham, did you have your hand up?
Yeah, please, Liz. And it's really just to add, I think, to what's already been said, but I think it's probably worth just adding that you'll be aware that we had the recently published Hewitt review on the functioning of ICB, so integrated care boards and indeed integrated care partnerships. And I think this point is really, really pertinent, which is within the Hewitt Review was a request or a proposal or conclusion for the NHS to spend 1% of its annual budget on upstream preventative activities. And I think this area the team are putting forward for your agreement today is precisely what the Hewitt Review was envisaging. It's beyond the usual tramlines of a public health investment. It's about a whole systems investment in terms of how do we support more people to live more independently in good health for longer. So you know there's a lot of work taking place into this space, but I think this is really, really key and a really positive recommendation or proposal that's been brought forward to you today.
Thank you, Graham. It would be really good if we got the ICB to put the money into, say, the 40 to 60-year-olds, if we're not targeting them. So by the time they come through to us, they're halfway there, almost, maybe. I don't know. Simon, you wanted to say something?
No, you're right, Councillor Fairhead. There's something for me about this is kind of targeting that higher end. We're really thinking about what we're calling the middle age. I'm not sure it's quite the right word, but really preparing for old age and working with colleagues again and designing some interventions. So you're right, how we begin to partner this. And I think the districts have a really strong role to play, as does the ICB. And we're helping them recognise that as clearly as we can, being the Public Health Authority.
Super. Thank you. Councillor Warwick, do you have any questions?
Yeah, I've just got one thing to say, that the website is really good. So it's got some really nice small films and narratives and stories in there that are quite funny, but actually will draw people in and realise even a small amount of activity can make a difference. There's a guy that can't walk, but he can play football, which is just bizarre. And there's another chap whose children use him for target practice, I think, in sort of they fire targets at him, but he can join in his wheelchair, which is just fantastic. So he's playing with his grandchildren, and he said he can't feel it when they hit him, which is just, it's a really nice story. So actually it appeals. It's not just people running or doing sort of activities that perhaps older people couldn't do. It's sort of broadening everybody's horizons for what they can take part in. So it's a great website.
Good, thank you. Councillor Withers.
Interesting. Well, it is a very important grant, and obviously the website, as we just heard, is very important. It's interesting, at the 2050 Scrutiny Committee last week, as Graham is aware, there's certainly Councillor House from the Liberals brought up about we should be looking at the children at school, because come 2050 they're going to be in that bracket that need to be fit and healthy. So it's a double-edged sword, isn't it? We've got to look after the people coming up to what we consider to be a sort of middle age, 70 like myself, but starting early at the 40s, 50s to get them. And I think if you talk to the PCNs, the primary care networks, and the community and district nurses, a lot of their patients are actually in the 30 to 50 bracket who actually are obese and got problems. So it is so important that we hit all areas, but particularly this one I think is critical, because there's a lot of people who still need to get out and be active from COVID, who haven't made that stride, and hopefully the districts, and particularly my area, Rushmore, will take it on board and work with it to ensure that the residents get the benefit from this programme. I think the messages are very important, and we must try and advertise that as much as possible, get them to get it on their social media in order that people can see it, take benefit from it. So I think it's a really essential grant.
Thank you. Councillor Briggs, do you have any questions?
No, not really. Just a comment, really, like everyone else. The earlier you can get people interested in exercise, the better. Couple of people I know who've had broken hips, and they're doing the strength-based standing up and balancing, and they all find it very beneficial. But they say I wish I'd done something like that sooner, because I might not have had my fall. So the sooner we can get it out, get people infused about exercise. And I think the only question is that the site is very good online, but if you don't go out about it, I don't know who I'm asking that to. Is it Abby?
No, I'm not sure.
Sure, I can start and then others can chip in. So alongside the website, we do also have a social marketing campaign. So that doesn't just include social media, but other forms of marketing material as well. And particularly through the communities of practice, we know that there's a lot of old people's forums in different shapes and guises, and really utilising those to share the messages both ways. So we want to be informed by those forums, but also use those opportunities to be able to go out and deliver talks and learning opportunities for our residents. Sarah, Simon, was there anything you wanted to add?
Thank you.
Not for me.
Not for me, thank you.
Right. Oh, Bill.
Yeah, can I just ask, does that include our libraries?
Yes, that's correct. Yeah, we've got some work in the pipeline with the libraries, but also to include them within the social marketing campaigns as well.
Yeah, because the warm and the cold place to be is very important that message gets across. And also the food grub hubs is a social centre at the moment. So I think, again, that's another area where we can advertise it.
Yeah, absolutely. And chat about, the list goes on.
Yeah. Abby, thank you very much. I'd be quite interested to have a catch up with you in a few months, just to see which districts have picked up and run with this and what they're doing. Is that okay? That'd be brilliant. Thank you.
Absolutely.
Right. I think that's all from me. I think it's over to you now, Jan.
Yeah, thank you so much, Councillor Fairhurst, and good afternoon. I'm the Executive Member for Younger Adults and Health and Wellbeing. So thank you for attending our continued decision day, which is webcast on YouTube via the County Council's website. Again, there are no deputations for the second part, but agenda item 2 is titled Demand Management and Prevention Grant Award, which is on page 13 of the pack. And Peter Stokes is going to introduce this paper, because actually there's much more to it than the title would suggest. So Peter, I don't know if you're happy to give an introduction to this paper.
Yes, of course. Thank you, Councillor Warwick. So this paper is, as you said, is seeking to award grants up to a value of £60,450 for a range of time periods, which I'll come on to later, as part of our Local Solutions Fund. Now, the Local Solutions Fund, as you're aware, is a grant programme we've been running since 2019. It's one we regularly make awards to. It's designed to enable small community groups and community-led organisations to deliver projects at that level, by providing them with startup funding or funding to increase their activities to new areas, if that's the case. In terms of the funding awarded, it's only funding provided for that one initial period. We do not provide continuation funding. Organisations are aware of that at the start before they apply that, and being reminded of that as they go through that process. And they also sign as part of that grant agreement an understanding that is the case as well. My officers will work with these projects to enhance them and to develop these ideas. So we don't look to turn projects away. So anyone can come to us with an idea. We'll either look to see what we can do to fund it. If we can't fund it, we'll provide that guidance or direction to other external sources of funding, which may be more appropriate if it's not suitable for us to fund. We do look to have coverage across the whole of Hampshire in terms of geographical reach. Although some of these projects will be local to certain parts of Hampshire, it doesn't mean other areas haven't been excluded. And actually, today we have got there's many from New Forest and haven't, although that is actually filling in some gaps which we have from previous awards where we've not delivered in those districts to the same extent. And we are conscious of that and actively working to ensure that every area has both a balance of that fund available to them, but also based that on need in those areas too. So in terms of the grants to be awarded today, we have 7. So So the Safer Futures grant is seeking for £12,000 for a year's funding between 6 months funding, excuse me, which is to deliver a 6-month course for 15 younger adults, those with the risk of social care, particularly through mental health, but it could also be those with learning disabilities. And it's about having a cognitive and psychosocial approach, support them to overcome the barriers to volunteering and more wider community engagement and potentially future employment. The project has those sort of specialist resources within it, but we'll be working alongside Community First, the CBS in that Havant area, to ensure there's a consistent flow across to those volunteering, and so it doesn't duplicate. It just enhances their offer, which Community First deliver at the moment. OpenSight seeking for a grant of £12,000 for a year. This is to support residents with sight loss and vision impairment across Hampshire, across Havant and New Forest. And this will be to support with practical home in-vision assessments, as well as benefits and money management. This project has been developed very much in association with our Century team, who have suggested both the Havant and New Forest areas as areas that benefit most this kind of provision and would be the most beneficial ones to trial this approach. If it is successful, as we said before, we can always seek to then roll it out to other areas as we move forwards. And that's one thing we look to do, is very much engage our community teams in developing these grants to ensure that it meets the needs of service users, either which we have at the moment, or those who potentially could be prevented, diverted, or delayed coming into requiring adult social care, by this involvement. The EC Systems Advice they're seeking for 13,000 for another year duration. And this is to provide a dedicated resource to focus on supporting carers to access that financial information and advice through home visits and community outreach, recognising that many of the services available to via Systems Advice are actually accessed by people coming into their offices. With carers, because of their caring responsibilities, often they find it very difficult to get to those centres. So this is to provide that service to them in their homes, which is more convenient at a time which is convenient for them as well, around their caring responsibilities. The Forest Forge was seeking a grant of £4,750 for a 6-month period to again work with adults with learning disabilities to increase their living skills, supported by a series of theatre-based workshops, which will kind of explore the themes of independence living, but will also be shared and filmed, so that video can also be shared to other people to act as almost an educational prompt and tool with other younger adults moving forwards. We have another learning disability project in the Friday Night Project, £11,000 of funding for a year again, and that's for to increase those independent living skills for those with mild and moderate learning disabilities in the Fair and Gosport districts. Although it's based in that sort of social and recreational support, uses that informal education model and formal workshops to increase those skills, and also seeks to build their networks of support in their communities, so they're less reliant on formal social care support, and also to avoid crisis. Kingsclere Residents Group are seeking a grant of £2,750 again for a year, and that's to expand. They've had at the moment a Kingsclere monthly meet programme looking to bring together, support older adults in their community with a social connection. This is to look to take it from a monthly project to at least a weekly project to ensure those connections are there, which is much more timely. It means they can respond to it, and also people can get that better response to loneliness and social isolation, so they can be engaged in those activities. They won't. I believe some of those activities will also be looking to be more recreational, so hopefully they're linking them to get into that physical activity as well, which also links to some of the stuff which has been talked about previously in this decision day. And finally, we have a grant for Making Space, a grant of £4,950, which is to support carers through creative sessions where which is kind of explore those issues through, again, that psychological sort of cognitive development, but also they can attend those with their person they think who is their cared for person, to enable them to kind of access that support within their community, as well as build that peer support network which is often very important to ensure that those carers can get that support they require and share their concerns and experiences with other people in a similar situation to them. So they're all 7 grants. As I said before, all grants will sign a grant agreement, which will make it clear there's a one-off grant award. We will also assign officers to these awards to both monitor the outcomes as they go forward to ensure that they do achieve what they've said during the application, and equally that we can monitor that to see where the benefit is and where we can take those lessons and learning, either to expand that further or to kind of inform future work and delivery. So that's a summary of these grant awards.
Brilliant. Thank you so much, Peter, and well done you for finding a good geographical spread, because I think we've covered pretty well the whole of the county, and a really good spread of ideas and innovative projects that we're funding. So that's super. And I think Councillor Fairhurst and I would quite like to visit some of these grants down the line once they're up and running. Councillor Fairhurst, you had a comment to make.
Yeah, well, it's a question actually to Peter, because I know we're very keen on telling people their grants for 1 year only, and we expect them either to become self-sustaining or to complete the work. The one in here that worries me is the one in Eastleigh, where they go to carers. Now, you know, in a year's time or 2 years' time, you'll have a different set of carers who might be stuck at home. I'm not sure how we can ensure that that work continues without giving another grant.
Well, I think in terms of this grant, it's almost a proof of concept. It's providing there's evidence for that to do so. We are working with them and the wider Citizens Advice Hampshire group. So the evidence bits can be collected over that period of the year, can be used to support further external grant applications to make sure they can build up that ongoing revenue funding to support that activity. Because yes, you're right, carers isn't a one-time, there's been new carers coming through all the time, and also those who may be caring at the moment who don't have any of those concerns but may do in time. The idea, though, we'll look to gather that evidence so then we can see how we can support them through other funding sources to enable that work to continue.
Super, thank you.
Yeah, that's a really good question. So in some ways, Peter, we're funding a pilot study, I suppose, for this. So it would be good to see the evidence outcomes in about a year's time once the grants come to an end, and it might be something we ask for a report back on rather than something you can visit, because it's not going to be one to visit, but actually to have an update. So if this is a concept that could be rolled out in other areas, that would be good to know.
Yes, sure. And equally, we do collect that monitoring information, and we can share that with yourselves, at that time to
yeah, no, that'd be worthwhile. I think we need to sort of account for that money and show how it's been of value then. Councillor Withers, do you have any comments or questions on this paper?
I'm aware of OpenSite and the work they do, and it is mainly in the south, but they have done work in the north as well. So we mustn't forget the north.
No.
I know you said Andover way and everything, but the northeastern part and us up north,
And that's why we're quite keen. We always look at the geographical spread of grants. We wouldn't want 2 grants close together. I know it's difficult, Peter, because you can't always control what comes in, but as far as possible, we try and make sure that there's something spread across the board. Sorry, Councillor Briggs, do you have any comment?
We would like to ask about Safer Futures. If they think they can turn around in 6 months 15 young people to stop them coming into social care, will that be long enough? I don't know Safer Futures, which in Havant area. Obviously, Councillor Fairhurst does, but I don't.
So it's a small organisation being led by sort of healthcare professionals with a psychological background. So I will be working quite intensively with them in terms of those sort of CBT and other sort of psychological approaches to ensure that they can then make that transition across to that volunteering. And we know that Community First have a supportive volunteering programme as well, which I will link into. Supportive volunteering is often where you volunteer not just as an individual but as a group. So it gives you, and with a supportive coordinator to provide that additional support. So it's not like just they would be out into the community volunteering, on their own. They'll be doing it as part of that supportive mechanism. It could be that some will thrive and can do that, but it's making sure this is the first part of that pathway, just so almost getting to that point where they feel like they can do that and do that successfully.
Yeah. Okay, thank you.
Brilliant. Councillor Withers.
Yeah, I'd just like to thank Peter and his team that come and looked at one of the charities up here in the north to see if they can get assistance. So, you know, that's worked really well, and it just demonstrates not only the support the county can give, but also they recommend other businesses and other areas which can assist those people, which we tend to forget about. There's a wide variety of people out there and businesses only too happy to help. But I think the point about carers is critical as well. We all know that's a critical situation or retention or recruitment.
Yeah, you make a really good point. And actually what strikes me with these grants is they're relatively small amounts of money, but can make a big contribution. And if they can work in partnership, that's even for the better. So I guess we're pump priming, aren't we? We're seeding a project that may continue to be funded in other ways further down the line. Peter, did you want to add something there?
Yes, I did. Two things. One, I didn't have the ability to say, in terms of open site, if that is successful, we've been working with our sensory team who recommended those two areas. I do take your point, Councillor Withers, but this isn't going to be offered in the north. However, if it's successful, we'll be working with the sensory team to look at further rollout. In terms of external funding, I can say that since the start of this calendar year, we have also assisted organisations to achieve or bring in an additional 700,000 from our signposting and helping them with support with applications. So we do, so away these grants are 60,000 and we've given others this year. We do also look to maximise the funding which is available to those organisations from any source, not just ourselves.
Brilliant, thank you so much. So moving on to the recommendations which are laid out on page 13, I'm happy to approve the award of grants totaling £60,450 to cover a range of time periods between August 2023 and September 2024 as part of the Local Solutions Fund. So I think that brings us to the end of my decision day as well. So I'm happy now to advise that the webcast should be stopped. Thank you.